Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 vertebral compression fractures occur every year in the U.S. Most are from osteoporosis, and a lot of them go unnoticed because they have no pain. They're called silent fractures. Half of women and a fourth of men will have an osteoporotic fracture in his or her lifetime. And once a compression fracture occurs, the risk of additional fractures in adjacent vertebrae increases fivefold. So the symptoms of compression fracture, first of all, a lot of these are silent, as I mentioned. They have no symptoms. There can be a sudden onset of back pain that worsens while standing or walking, limited spinal mobility due to the pain, and you can have height loss, deformity, and disability. Think about it. If you lose height here, mostly in the front due to a compression fracture, then you have one above and below, you can start to get what's called a kyphosis, where a person starts to bend forward. So here's the downward spiral of compression fractures. You get a spinal fracture, you have back pain, you start getting deformity with leaning forward, it starts pinching on the lungs, and then you get impaired function with breathing. You start to lose your appetite because it can pinch on the stomach. Then you start having sleeping issues. You're not as mobile because of the pain and the fact that your spine is sort of in kyphosis and you're leaning forward. This leads to more bone loss because you're not as active. This leads to increased fracture risk, so on and so forth, and almost a fourth increased mortality as a result of this downward spiral. Treatment options for vertebral compression fractures include benign neglect, which means if it's not hurting that bad, you can just simply watch it. You don't have to actively treat it. Medication management, such as over-the-counter nonsteroidal anti-inflammatories, Tylenol, narcotics, muscle relaxers, spinal bracing, such as you see here, this is called a Jewett brace, Jewett. There's 2 points of compression on the front and then a back stabilization. It helps keep the person upright and having less pain. Before we discuss vertebroplasty, you can also do epidural steroid injections around the areas where the fracture occurred. Sometimes these fractures can irritate the adjacent nerve roots and can cause pain into the buttock or around the front, so that can be helpful as well. Vertebroplasty was invented back in the 1980s for cancer fractures, and then about a decade later, it started to be used for regular osteoporotic fractures because it works so well. It's an outpatient, low-risk procedure that provides instant pain relief, where you put the catheter in here through the bone, called the pedicle, into the fracture, and then you inject bone cement. You can do it bilaterally through this pedicle too. Now, the kyphoplasty is more of an evolution of the vertebroplasty procedure. It was FDA cleared back in 1998, and then over the next 5 years, it started to get more and more popular, and it remains popular to this day. It's similar to a vertebroplasty with bone cement, but involves balloon placement first, okay? So you put the catheter into the fracture, and then rather than just injecting cement, you actually inflate this saline-filled balloon. It pushes the fracture fragments above, below, wherever, and it creates a bony void. Then you deflate that and then put the cement in slowly. So here's the cartoon that shows it. Put the catheter in the fracture. Then when you're happy with the placement, you inflate the balloon. You can actually see this inflate because the saline has dye in it. Then when you take it out, there's this bony void, and you slowly put bone cement in to fill that. And the procedure's done. With regards to the outcomes of kyphoplasty, most patients, over 90%, see dramatic pain relief right away with significantly increased function, such as with walking and performing activities of daily living. There may be some aches and spasms that continue for a few days to weeks after the procedure, but this should resolve nicely. So there have been lots of studies showing the immediate benefits. There have been a few that have shown questionable benefit. Those are far outnumbered by the ones that show excellent results. The Washington Pain Network offers the top non-operative pain management in the state through multiple clinics. Over 50 insurances are accepted, with over 25 treatment options being provided, such as with kyphoplasty and vertebroplasty. The board-certified award-winning doctors overall achieve 90% success rates plus. Look at us online today at WashingtonPainNetwork.com, and then call us at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.